Hi, welcome back to my channel. Today, we're going to talk about the difference between Medicare and Medicaid. Most people don't understand the difference. I'm a long-term care planner that guides families through the transition to long-term care. I'm not an attorney. Grab a pen and take notes. Medicare and Medicaid are two separate programs, and they have different purposes and different eligibility criteria. Medicare is primarily designed for individuals age 65 and older, as well as those with disabilities. Medicare's job is to help you get better. Medicare has different parts, such as Part A, which covers hospitals and other services, and Part B, which covers doctors and other medical services, Part C, which is an Advantage plan, and Part D, which is only a prescription drug plan. Medicaid offers health insurance for children, adults with disabilities, and seniors with low income. Medicaid offers a wide range of services from basic medical care to long-term care and assistance with daily living. It will help you get better, but it will also help pay if you don't get better. There are lots of Medicaid programs, but two important Medicaid programs for seniors include the Medicare Savings Program for individuals who have both Medicare and Medicaid. This program is the program that Medicare commercials are talking about, most of them anyway. The other very important program is called the Home and Community-Based Service Waiver Program. The Medicare Savings Program has different qualifying levels based on your income, and depending on the level of Medicaid you qualify for, the program could pay for your Medicare Part B premiums, possibly deductibles, coinsurance, and co-payments. The Home and Community-Based Services Waiver Program helps people pay for services that enable them to live in their homes or the community rather than an institution. It's important to understand the difference between Medicare and Medicaid because, well, Medicare does not pay for long-term care. The good old Medicare and You book will tell you that. Medicaid programs do pay for long-term care, and you can get assistance that you would otherwise not be able to afford. If you or your loved one needs assistance with activities of daily living, such as transferring, which is getting around, moving from a bed to a chair, or walking to another room. Toileting, can you get up and down from the toilet without falling over? Continence. Bathing, do you need assistance while you're in the shower? Dressing, could you put your clothes on without falling over? Or feeding yourself, actually putting the food in your mouth, not preparing the food. Or if you or your loved one have a cognitive impairment such as dementia, Alzheimer's, Parkinson's disease, and safety is a concern, you could possibly qualify for assistance with one of the home and community-based waiver programs in your state. Watch our video called Your Medicaid Application Can Get Denied If You're Not Organized. It's full of very important concepts to understand when you're going through the Medicaid application process. If necessary, watch twice and take notes. Too often, families wait until something goes wrong before they start looking for the important documents that are needed for the Medicaid application. We've learned how important it is to prepare ahead of time, specifically for long-term care. So we created the Asset Guard Organizer. It is a hands-on tool to help you take proactive steps to organize and protect the critical documents your family or trusted helper will need when applying for these Medicaid programs. It's a step-by-step system designed to unburden families caring for a loved one. Send me a message or make a comment in the show notes if you are interested in learning more about the Asset Guard Organizer. If you have any questions about Medicare and Medicaid, or you want to share your experiences with these programs, leave us a comment below. Remember, I'm a guide. Your situation might need an elder law attorney, and not all elder law attorneys understand Medicaid law, and that could really cost you thousands of dollars, so do your homework. What you're going through is incredibly difficult. We're here to help and have many more videos on our way. So take a minute to subscribe to keep track of what we're posting. Thank you for watching. We'll see you next week.